My guest today is Dr. Alice Hoyt, a board-certified allergist and the author of Navigating Food Allergies, a parent's guide to care, coverage, and confidence. Alice spent her working life helping families make sense of a food allergy diagnosis, from decoding a label that says a product may contain an allergen to deciding whether oral immunotherapy is right for a child. In this conversation, we get into the why the word cure doesn't belong in allergist vocabulary, what the evidence actually says about allergic reactions on a plane, and how you start handling responsibility for a food allergy back to the child who has to live with it, whether that's your child or a child you care for. Alice, welcome. Well, I'm really interested in your book. So let's just get the book out. I was going to say out the way, not out the way, but let's put the picture up. Navigating Food Allergies. Um, and this is particularly written for children in mind, and we do have a lot of parents that listen, but at the same time, we do have a lot of adults. And I think that your book is just as relevant whether you've got a child with allergy or you've got allergies yourself, or actually you're just generally interested in that in allergies.
Thank you. I appreciate you saying that. And I've gotten that feedback too that, this is a really great book. It's Navigating Food Allergies, a parent's guide to care, coverage, and confidence. It's a great book for these parents, and I wrote it for the parents and noting some of the challenges that parents go through. But absolutely within the book, the purpose of the book is really to just serve as a framework for families who are walking the road of food allergies so that they know what to expect. They know what questions to ask because you don't know what you don't know, right? And it really just underscores the importance and the value of obtaining information yourself from evidence-based sources, from good resources, and being informed as you walk this road with your child. I find that the more information, the more education that I can provide patients in my practice, that I can provide families, that they are more empowered to have control over their food allergy journey.
Before we dive into the book, and also I do want to ask you a bit about your background as to why you went into this, because it's obviously very relevant and personal to you. I came back on a plane last night and they did this normal call. I say normal call, but you hear it often. There's somebody with severe nut allergy. Please do not eat nuts. And, it feels like there's a red alert going out everywhere. So, first of all, what does that actually mean? Do we all need to really worry? I'm sure we do. But the next thing is they then start handing out biscuits that don't have nuts in them, but it does say on the packet this is created or manufactured in a factory that does work with nuts. So is that contradictory or what?
It's also messy, right? So on a label should be very clearly marked with ingredients of what is in this food. And where consumers start to get concerned and where we as allergists start to get concerned is with these precautionary labels that manufacturers will apply to foods that say, oh, this may contain this may contain that. Well, that's not helpful. That language is not regulated, meaning there's no standardized definition of, okay, if there is under 5 micrograms of peanut or between 0 to 5 or some range, some number, something objective, then that's when this regulatory language would apply, but there is no regulatory language for the precautionary labeling. So it just makes it really messy where you can see a food, clearly read the ingredients, your allergen is not in the ingredients list, and then you see this precautionary warning. You're like, what do you do with that? And that is something where I advise my patients, we talk through what is the food, how likely is it that there really would be, a peanut in that tree nut trail mix bar where that company also does make a peanut bar, right? Compared to how likely is it that peanut is in this other bar that or cookie or anything that the manufacturer doesn't even really make. And we talk through those things. So there's nuance in food allergy. There can be a lot of nuance in food allergy. And that's also where the issue about the airlines comes in. There's a lot of discussion right now about airlines. And, unfortunately, when we hear about these food allergy tragedies, and, if you're listening to this podcast, then you know that it's rare that a food allergy death occurs, but when it happens, it is tragic. It should not occur. It is 100% preventable. And so when it does occur, it's terrifying and it's tragic. And we keep hearing about these issues on planes and about foods not being clearly marked and people having accidental ingestions and allergic reactions at 40,000 feet. And so even though the science is not there to support that somebody 3 rows back eating peanut is going to cause you to have anaphylaxis if you're allergic to peanut, because the way allergic reaction happens is when the allergen and the allergy cells bind. And with food allergy, that happens when you ingest the food. Incredibly rarely with things like frying fish do the proteins go more airborne. But we have studies that demonstrate that peanut is pretty heavy. It's going to float down to the ground just right on top of that person's tray table. It's not going to become aerosolized unless it's intentionally aerosolized in a laboratory setting. And so the concept of having a reaction to that type of scenario is incredibly unlikely. But that doesn't mean that a family who has seen their child nearly die from eating a peanut, eating a cashew, eating wheat, eating any of these allergens wants to be enclosed in a tube 40,000 feet above the air for 3 hours sitting next to that food. And that absolutely, that type of, when kiddos get older, when they recognize like, oh my gosh, I'm allergic to this, I can't have this, they've been told this, then when they do see it, they absolutely can have physiologic responses to that. Or when they know it's on board, they can have physiologic responses. They can absolutely have a fight or flight, that increased heart rate, trouble breathing, flushing, these things that can absolutely mimic anaphylaxis. And I always like to validate patients' feelings when they talk about this, because you mentioned earlier in my personal connection, I don't talk about this much, but my husband has a peanut allergy, and so I can see, and he is a grown man, he is a physician, he is very evidence based, but I can see the look on his face when he is sitting next to somebody or near somebody who is eating something that could potentially kill him just with one bite. So it's a lot about mindfulness. There's been so much somewhat poo-pooing sometimes of our food allergy families, and so sometimes it shifts to the other side of the spectrum. It's really unfortunate. That being said, that's one reason I wrote the book, is because the book gets really good information into the hands of families, a lot of families who already knew a lot of this stuff. Some things I think they don't know, especially sort of what the journey should look like, who should be on your food allergy care team. But to your point, I've gotten a lot of feedback about this book being really great for grandparents, for friends, for people who aren't necessarily the parents of the person with the food allergy, but they need an unbiased, non-sensationalized, non-fear-mongering, but evidence-based, straightforward approach to what really is a food allergy and how should they be managed.
And I think that's very clear when you pick up your book. It's very much right. Okay, we're going to talk about allergies. We're going to strip it right down to the basics, and from there, we're going to start building your knowledge, basically at your pace as well, as as fast or as slow as you want to go, and as in depth or not. And I thought that was really good. And it's also about ownership. It's an ownership for the if it's the child, then it's the adult. It's important the adult understands it and how to take that child through the ages, and also how you transition the child into understanding and owning and managing.
Yes, that is one part of the book that definitely stands out to me as something that think can be just so helpful to so many families, is really providing a roadmap for how to transition the responsibilities of managing a food allergy over to your child. Because the last thing we want is when they're graduating from high school and about to go to college, live on their own, whatever the case may be, is that they've never called and scheduled their allergy appointment. They've never requested a refill of their medication. They don't know how to schedule a lab visit. They've never done any of these things, right? Much less talk to the wait staff about what they're allergic to, making sure that they're self-carrying their emergency medication. It is a lot. And when you say it like that, it can kind of be overwhelming. But that's why we start early, and we start, how do you eat an elephant one bite at a time? And we start applying these tasks when children are young, and I very nicely lay out in table form. I love tables. At what age
Yeah, there were a lot
parents.
of tables.
Yes, yes, I love tables. And so, because it organizes things, it very clearly states if this, then that, right? If this is their age, this is when you want to start having them talk to the wait staff. But then when do they need to have mastered that? And it really lists out these key tasks that if we start working on this when a kiddo is early education, even from a young age saying I'm allergic to whatever it is, that's the first step. And then yes, the parent having ownership and teaching their child to have ownership and letting their child have ownership and holding their child respectfully accountable to that ownership. So yes, I think and that also can apply to so many different disease processes. Our kids with asthma, our kids with sickle cell, our kids with whatever chronic condition, diabetes, starting young and giving them age appropriate tasks that they can take ownership of and building on that so that when they are young adults, they've got it.
Yeah, absolutely. And understanding that's not you being hard, it's you actually saving their life for the future when you're not there.
Yeah, and I'm a parent, and sometimes the disciplining is hard, and it would be easier to just do things for them myself, right? But then that's not, as a mom, that's not me setting them up for them to be successful, for them to get from their point A to their point B, wherever that point B may be. And so it is important for us as parents to do that hard stuff and do it with love and with kindness, but to do it, and it's never too late to start.
No, and I think that well, actually, we could be talking about anything really when we just said all that,
Yeah,
but it's so
right.
true, isn't it?
Yeah.
So, and I think one of the basic things, and it sounds so obvious in your book when you say go and find out what the food allergy is. Now that sounds really obvious, but clearly it's not such an obvious thing for people to go and do it, and B, do it in the right way.
Right. No, that's completely right. We definitely have an overdiagnosis of food allergies where maybe a well intending clinician ordered a panel of tests, and this panel of tests came back with all these positives. And the parent's like, wait, but my child eats this all the time and doesn't have this hive swelling, trouble breathing. Or well, my child eats this, but it's not until a few hours later where they're vomiting. Like, what's going on? Do I have to avoid all of these foods now? And that's why it's so important to get plugged in with an allergist who does really sit down and spend time with you to talk through what is your child allergic to, what is safe for your child, and what are we going to do about both of these. And yes, absolutely, getting clarity on that diagnosis is when a patient comes to me for consultation, that is my top job, is to find out what is their diagnosis, what are they allergic to, and what is safe for them.
I'm also really interested, and I know sort of we're jumping around because we haven't got loads of time, but and there's so many questions that I could ask you. Is the I can't remember what it's called, the oral immunotherapy. So when we start going into treatments, and we've all heard where you give a little bit to someone to see if there's a reaction, and then how you use that as treatment in hopefully progressing somebody on that either they can eat it or they can't eat it.
Right. And so, what oral immunotherapy is when we take very small amounts of the allergen, like say somebody is allergic to peanut, then we can actually take incredibly small amounts of peanut butter or of peanut powder and give that to them every day, every 2 to 4 weeks, have them come back into the office or even virtually, depending on a child's risk profile, going up on that amount. And when I say small amounts, I'm talking like 5 milligrams worth of peanut, whereas one peanut has 300 milligrams of peanut protein.
Oh
And
wow.
right, and so it's really small amount. It's enough to that the immune system can recognize it, but it's not so much that it's triggering an allergic reaction. And so over time, every day taking these small amounts of peanut and then going up, 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 it actually teaches the body, oh, let's tolerate this. Let's not have a severe allergic response to this. We're getting more and more data that the sooner we start this, the the more likely it is that the child will be able to freely eat the allergen. And I do see that in my practice often when we start kids on oral immunotherapy early, like when they're a baby, when they're under 2 years old. Many times by the time they're going to kindergarten, they're eating peanut butter and jelly sandwiches. And that's not just my experience, that's experience of allergists across the country here in the US and then also in other parts of the world. And so we know that by intervening early, we can absolutely shift the immune system away from that allergic response. That also leans into the LEAP study, learning early about peanut, which very clearly demonstrated that in kids who are at risk of developing peanut allergies, let's start them eating peanut very early and often, so as early as 4 months in the LEAP study. And what that demonstrated was that early introduction and regular feeding of the allergen prevents those kids from actually developing the allergy. So it's really sort of leaning into that, okay, let's go low and slow. Let's teach that immune system to tolerate the food. And again, this has to be done under the supervision of an allergist who has experience doing this, but there are more and more of us. And in fact, we're having a conference in the UK in April. The food allergy support team, we do a conference in Dallas every year, but we're doing one in April in the UK.
Oh, so two things that I kind of learned or was interested in is that so one is that you're getting people to tolerate it, and then the other one is like a cure. And I was quite interested in the tolerate means you have to carry on, but the cure means that you don't have to. Well, correct me if I'm wrong, but the cure means that once that you can tolerate it properly, you don't have to keep being given it to for the almost like for the body to be reminded. I know I've
Right,
completely cocked up
right.
saying that, but you know what I'm
No, I
trying
know
to say.
exactly what you're talking about. I know exactly what you're talking about. And this is the hand motion that I do in my office when I'm talking this through with a family. So many times we don't like to say something is a cure because a cure is when you have a condition, you apply the cure, the condition goes away, and then you can remove the cure and the condition doesn't come back. With oral immunotherapy, we know that when a child has a food allergy, like a peanut allergy, we do OIT. They're then able to tolerate the food. In some cases, maybe a peanut a day. The sooner we start, though, the more likely they are to be able to freely eat peanut. But we never want to take away the peanut. We never want to take away the therapy because we know that if we take it away for a month, then maybe a few kids will then develop those symptoms upon re-exposure. 3 months, 6 months, more and more. So the longer you avoid the allergen again, the more likely it is that when you do ingest it, that you'll have a reaction. And so in my practice, the goal is not to beat down the allergy, think we have it cured, and then let's have them strictly avoid it for 1 month or 3 months or 6 months or whatever, and then challenge them again to answer that academic question of, well, did we really, beat it into submission? But our goal is to get that child safer. And the way we get them safer is by teaching their body to tolerate it and not taking away what is teaching their body to tolerate. And so to preserve the tolerance that we've developed, kind of like going to the gym. You get to where you want to be, and then if you just totally abandon all of that, then you're going to get back to where you were, right, at some point. And so you have to do something to preserve the tolerance that you've developed.
And I think that makes sense. And you're absolutely right about the gym, which is really frustrating. You do all this work, and 2 weeks later, a lot of the work is gone, isn't it? But I,
Oh, wait, can I go back to something too that you said
yeah,
about the we'll have them taste a little bit of it to see if they're allergic. Sometimes, so what that is called an ingestion challenge, and that's a formal procedure that we'll do in the office if we're concerned a child is allergic. When we're talking, but sometimes that gets confused with early introduction. Early introduction is when we're giving the baby a small, like whatever a serving size is for that little baby based on their age, but a small amount of peanut butter diluted with breast milk or water or their favorite puree, and feeding it to them not to test whether or not they're allergic, but because we know that in that early age group, that young age group, it's highly unlikely that they are allergic. So we need to start feeding them the food to help grow the tolerance to it so they don't become allergic. So sometimes people think, oh, well, I can just give them a little taste and then they don't react and then I don't have to worry about it anymore. And that's absolutely not what we want to do. We want them to feel confident in feeding the food because the likelihood of having an allergy at 4 months is super low. And if a child were to have an allergic reaction, the younger they are, the milder the reaction is. So it's very rare for a child in the first 6, 8 months of life to have hives, swelling, trouble breathing, vomiting, drop in blood pressure, that type of severe allergic reaction. In our babies, the most common symptoms are going to be hives and some vomiting. And so that type of information I find really empowers families to go ahead as soon as possible and start feeding their kiddos early and often those allergens.
Mm. No, I think that's really important. And I was going to say, I mentioned the word cure, and I think most people that work in chronic conditions, the word cure is like you kind of go backwards a bit with it when
Mm-hmm.
you hear it. It's always a bit
Mm-hmm.
worrying.
Mm-hmm.
Um, we always seem to, and when we talk about allergies, I don't know why, but one always goes to peanuts, and clearly peanuts aren't the only problem, but but it
Right.
is always peanuts, isn't it?
Peanut is the diva. Peanut gets all of the attention. Most of the studies are done first with peanut for treatments, things like that. But I'll tell you, the allergen that really makes allergists uncomfortable is cashew. We're finding more kids have cashew allergies, and that very small amounts of cashew can cause quite robust reactions.
And the other thing that I was kind of quite interested in was that, first of all, you're saying making sure, and I know we've gone through it, but clearly it is fundamental. You get the information from the right people at the right time, always evidence based. And the one other thing that you do mention a lot, and I think it's so important, we know that most people get, or a lot of people get their health information from social media. And that is always really worrying. What are the things that you see on social media that make your hackles go up, for want of a better word?
Oh, oh heavens, there's so much, right? I think some of the biggest things are when somebody is touting themselves as some sort of expert, but they're not an expert, and providing information under the guise of, oh, well, I have this sort of certificate training, or I'm a nutritionist, or this, that, or the other, and I'm going to talk about how you can cure your allergies, and oh, buy this test online, or something like that. When really, truly, the allergy experts are allergists. We go to medical school, we go to internship, residency, do additional fellowship. In fellowship, we do research, we do continuing education. There is so much education, true education, that goes into understanding the immune system to truly understand what allergy is and how we can best treat an allergy. And again, that comes back to diagnosing the allergy. And I talk in the book how there are multiple types of food allergies, of immune mediated allergic conditions. And it's so critical that a person have the right diagnosis so that then they can have options for a correct treatment. And so social media, it definitely has its pros, things like this where patients can access really good information. But things where making claims of cure, sensationalizing, fear mongering, especially the fear mongering part, I think that's the part that really bugs me the most, is when some people really try to utilize food allergies as a way to sensationalize, or it almost glamorize it. And it's it's so frustrating to me, because those are issues that I have to work through with patients, because they've been fed this information that, yes, an anaphylactic food allergy can absolutely be fatal, but those cases are very rare. And through good information, through making wise choices with your child, in many, many cases, you can prevent that. And I mean, that gets back to the airlines. Why sometimes the airlines are getting such a bad rap right now is because there's not transparency, and you don't have access to a lot of food if you're on a plane, right? So those are some of the things that really bother me. I think the sensationalization of food allergy, the fear mongering, the over promising and under delivering. I tell any patient that comes in, the cure, we don't use the word cure. And anyone that is telling you the word cure, turn and run, because every child is different. Even if it's a young baby in there and it's a peanut allergy, and I'm confident that we can desensitize this kiddo and that this kiddo will be eating PB&Js by the time he gets to kindergarten, I'm not going to sit there and tell a parent I can cure your child because I don't know if I can cure your child, right? I know that we can work together, and through shared decision making and on this multi-year journey, we can help grow tolerance to that food to make your child safer, to get your child to freely eating in many cases, but at least get them to bite safe so that you feel confident when you send your child to school. But the sensationalization is probably the most annoying thing to me when it comes to social media.
Alice, thank you so much for your time today. And all I can say is I recommend go out and have a look at the book. And what would you, if there's one thing that you want people to take away from having, read your book, what would it be?
I think, and I put this in there, like, you've got this. You've got this. You can do this. Especially for patients who are newly diagnosed, you've got this. Look through the book, find a good allergist that you can pose your specific questions to, and you've got this.
That's really reassuring. Alice, thank you so much. Whether you're watching on YouTube or listening as a podcast, please don't forget to subscribe and hit the like button or leave a comment. But more importantly, if you feel this episode might help someone you know, please do pass on.